Thank you so much. Thank you for inviting me. And let me get my PowerPoint ready and we'll be ready to go. So I'm going to screen share.
Perfect. We see it.
Perfect. Do you see it now still?
We sure do. Yeah.
Okay, great. Thank you very much for inviting me to speak here. Like you mentioned, I am an adult gastroenterologist and I am in a private practice in Delaware, which is where I grew up. I am a mother. I have 3 little girls and they keep me very occupied in my spare time. But I have a passion for teaching and I see patients all the time coming in with GI symptoms and issues and irritable bowel. And many people don't realize how much of a role lifestyle and diet plays. So I am really excited to share what I know, and I hope that this helps some of our viewers. So today I'm going to talk about irritable bowel syndrome and the brain-gut microbiome connection. Simple strategies to create your happy, healthy gut. I have no financial disclosures. I'm going to start with a clinical scenario, and this is really typical, a typical patient that I would see in my office. This is a 37-year-old female, and she comes to my office with on and off intermittent abdominal pain. Her symptoms have been going on for the last 15 or so years. The location of her abdominal pain can vary. Sometimes it's on the right, sometimes on the left. It's very difficult to characterize. It can be associated, or it often is associated with diarrhea, but then sometimes she comes in with constipation. And she also reports she's been getting a lot more bloating lately. By the time she has seen me, she has really had a thorough workup. Like I mentioned, she's had this for 15 years. So during that time period, she's already had a CAT scan of her abdomen. She's had an abdominal ultrasound, and she's also had a colonoscopy. And really everything has come back completely normal. So when she comes to see me, she has a number of questions. She wants to know, what does she have? What's her diagnosis? What is the cause of her GI issues? And what can she do to cure her disease? So today I'm going to talk about irritable bowel syndrome. Irritable bowel syndrome is very common. It affects 1 in 5 people. It is one of the top 10 reasons for somebody to go to their primary care doctor. It is the most common diagnosis in a GI practice, and it accounts for almost 1/3 of all GI office visits. It's typically seen in patients 20 to 40, but I'll tell you that there's a really wide range. We are seeing a lot of irritable bowel in younger people and also a lot of irritable bowel in older patients as well. It tends to be more common in females, but males can get this as well. Irritable bowel syndrome really affects people's quality of life. Many people have to miss work. On average, patients with really severe IBS can miss 2 days of work a month. And many patients with really severe IBS would even give up 10 to 15 years of their life expectancy if there was an instant cure for their IBS. There was a research study done, and they asked patients with severe IBS, would you be willing to take a medication if there was a sudden chance of death of 1%? And patients with severe IBS said yes, they would take a medication even if there was a 1% chance of death. So I give you this information to let you know that irritable bowel syndrome is common, and it's really very debilitating for many patients. It also has a significant burden to our healthcare system. The total annual cost is thought to be somewhere between $1 to $10 billion. And that's because people have to miss people have to miss work. They have to get testing done. They need prescriptions. They go to the ER, and often it's because of unnecessary testing and treatment. Now, what I see as a gastroenterologist specialist and what primary care doctors see is really just the tip of the iceberg. This is accounts for about 25% of patients that we suspect to have IBS. We call them consulters. We actually think that there are a lot more patients that have symptoms of IBS, but they don't even address it with anybody because they don't think that they can have any solution. They don't think they can feel better at all. So let's go over the irritable bowel syndrome definition, and this is based on the Rome 4 criteria. This was discovered and made by Dr. Doug Drossman, who was actually one of my mentors at the University of North Carolina. So the Rome 4 criteria for the diagnosis of IBS includes recurrent abdominal pain on average at least 1 day a week in the last 3 months, associated with 2 or more of the following. 1, they have to have some pain related to defecation and to having a bowel movement. So for some people, they might get relief after they have a bowel movement. Some people might have worsening pain when they're trying to have a bowel movement. There's also an association in the change in frequency of stool and also a change in the form or the appearance. These criteria need to be present for at least 3 months. And that's important because this is not an acute issue. This is not something that is sudden and acute. That really tells us and clues us in that maybe something else is going on. This is something that has been going on for a long period of time. When we diagnose irritable bowel, it's really important to make sure that there's no other disease process going on. So things that we consider as red flags, these things need to be worked up, and these are not irritable bowel. So blood in the stool, unintentional weight loss, change in bowel habits, night sweats, any of those things require further workup. It's also important to make sure there's nothing else going on. For example, celiac disease. Celiac disease can present with some similar symptoms, so that would need to be evaluated to make sure you don't have that. Thyroid issues, hyperthyroid and hypothyroid can also present with some of these same issues. Lactose intolerance, inflammatory bowel disease. So it's important that when you're having symptoms, you do talk with your doctor to make sure nothing else is going on. But really importantly is that irritable bowel syndrome is a clinical diagnosis. It's based on having a conversation with the patient and understanding what symptoms they're having. And there is no single test to make the diagnosis of IBS. I have so many patients coming in asking me to get a test done, and they want the test to be positive so that they know what they have and that they have a diagnosis of irritable bowel. But with irritable bowel syndrome, there's not a test that I can order. There's not imaging, not even a procedure like a colonoscopy where something is going to come up positive for irritable bowel. And that can really be very frustrating for patients. I have patients come to me who have had this extensive workup and they're still having pain, they're still having discomfort, they're still having bloating. And they ask me, is this all in my head? Am I making this up? Am I crazy? Like, what's going on? Because I'm clearly having bloating, gas, discomfort, and everything is coming up normal. So we used to think that irritable bowel disease was a psychiatric illness. Before, when we used to do the workup and we thought everything was negative and normal, we would actually tell people that you need to see a psychiatrist because there is nothing wrong with you. We now know that that is not true. That is not the case. Patients with IBS have true disease. They have true symptoms. It's very important that your doctor does believe you because it is not all in your head. We know that there are clear GI manifestations and there's something going on. So we're going to talk a little bit more about that. So I want to talk about the brain-gut axis. There is a direct communication between the brain and the gut, and they are in constant communication. The brain is constantly talking to your GI tract, and your GI tract is constantly talking to your brain. The brain can influence motility, secretion, the microbiome in our gut, And our gut can also influence our mood, our behavior, neurotransmitters, stress, and anxiety on our brain. And this constant communication is done through the vagus nerve. And so, many people actually refer to the gut as the second brain. And, evolutionarily, the gut came first. So sometimes I like to think of the gut as really the first brain, because I really believe that disease processes and a lot health medical conditions all arise from issues related to our GI tract and our gut. And we used to think that there was just a brain-gut axis and brain-gut connection, but we now know that there is a third part to this, and that is the microbiome. There's actually a gut-brain microbiome connection, and we'll talk about that. So have you ever experienced those butterflies in your stomach? Maybe you have a big presentation to give. Maybe you have a meeting with your boss. Maybe you're going on a first date, or you have something exciting happening. So we've all had that pit in our stomach, those butterflies in our stomach. And when you think about that, that's our gut telling us and signaling to us kind of what our emotions are and what's going on in our brain. And irritable bowel syndrome is really when that becomes super heightened and people actually have debilitating symptoms because of what's going on in their gut. So many of my patients will tell me that, maybe I just have a sensitive gut and it runs in my family. My mom has it, my sister has it, and I just have a sensitive gut. And, actually that is true with patients with IBS. Visceral hypersensitivity is a hallmark of IBS. Over 35% of patients have increased hypersensitivity. Now, this was a study done where they actually took rectal probes and they put it in people's rectums and they inserted the balloon with fluid and air. And they asked patients to tell them, okay, when do you start to experience discomfort? When do you experience pain? And what they found were that patients who had IBS were more likely to experience pain, sensitivity, discomfort at a much earlier threshold than patients who were otherwise healthy who did not have irritable bowel. So this was a study that really showed us that, again, it is not in your head. There is an issue that's going on with the nervous system and the GI tract, and people do have more sensation in the GI tract with IBS. This was a study done 2019. It was published in Gastroenterology, which is one of our top GI journals. And it was actually done by Dr. Simran, who also trained at University of North Carolina. And what they found was that visceral hypersensitivity, abnormal colonic transit, and psychological factors are all associated with IBS. So again, people have increased sensation. They have changes in their colonic transit. So either things are moving really fast and very quickly, or they have delayed transit and things move very slowly. And then third, that they have often have anxiety or depression, which is related to this. And they found that the more of these that they have, the more severe their IBS symptoms. So there's a cumulative effect to this. And then that in turn impacts quality of life. So I'd like to talk a little bit about the gut-blood barrier. So there is a very thin layer of epithelial cells that separates what's in our GI tract and what's in our gut from what's in our blood on the other side. Now, that layer of epithelial cells and that barrier has a really important function. The goal of that is to prevent harmful pathogens from entering our blood. And so that layer is made up of immune cells, epithelial cells, enteric cells. And what's really interesting is that our gut has its own nervous system. And there are over 500 enteric nerves in our GI tract. So 500 million nerves in our GI tract. So there's more nerves in our GI system than in our spinal cord. So our GI tract and that gut-blood barrier is really important. When we have anything that affects our brain, any environmental issue, any stress, any early adverse events, any PTSD, that in our brain influences our GI tract through the hypothalamic pituitary axis and through our autonomic nervous system. In addition, there are things that impact our gut, which will then impact our brain. Diet, pathogens, inflammation, antibiotics, probiotics, all of these things can either help or hurt that gut-blood barrier. So, we've all had that gut instinct, that feeling that we know something is happening, we can't explain it. And what I'm here to tell you is I want you to trust your gut instinct. When you have those feelings, sometimes your gut is telling you something before you even know it. There are many patients that come to me and they're coming in with GI symptoms, bloating, diarrhea, constipation, pain. And I'll ask them, think about what is going on in your life. Is there something stressful happening right now? Have you changed jobs recently? Is there something going on in your family life, in your personal life? Many times patients will think about it and they actually can't find any trigger. But then when I see them a few months later, they'll come back to me and they say, you know what, I thought about what you said and you are right. I didn't know it at the time, but I was having a stressful situation at home, or I was undergoing a job change and that was stressful. And I just didn't process it. Like wasn't able to think about it yet. And that's because sometimes those GI symptoms manifest before our brain is able to process it. So don't ignore those feelings you have. That's really important. So this was actually a study I want to talk about. It was done by one of my cousins, Dr. Pasricha. And what she did was she put electrodes on people's abdomen. She put a blood pressure cuff on people and measured their blood pressure. And she put heart rate monitors and breathing monitors on patients. And what she did was she asked them to do different tests and to lie. And she monitored to see what was going to pick up those lies faster. And what she found was that sometimes people were able to lie, but they were able to control their heart rate. They were able to control their breathing rate. And they were even able to control their blood pressure. But the one thing that was most difficult to control was their GI tract. So she found that when people were lying, the GI tract would start to spasm and the GI tract was not able to hide it. So it's really interesting research because I think in the future, it wouldn't be surprising if when we are doing lie detector tests, we actually start monitoring people's guts because, we can't hide that. All disease begins in the gut by Hippocrates. And I think this is so true. And so what we need to do is understand what things and what factors impact our gut. So I am a physician. I am a mom to 3 girls. And I used to think that all bacteria was bad. I would come home from the hospital. The first thing I did was shower. I was really, obsessed with being clean and antibacterial and microbial soaps. And if my kids had pacifiers or toys that fell on the floor, I was super vigilant about cleaning everything because I didn't want them to put anything dirty back in their mouth and their hands. So I now know that that is not probably the best thing that I was doing, and that we all have good bacteria and bad bacteria. So when we think about bacteria, we shouldn't be thinking always about it in a negative context. I want to switch for a second and talk about the role of the gut microbiome. So the gut microbiome is an ecological community of microorganisms. It consists of bacteria, fungi, viruses. There are more than 1,000 different species of known bacteria and over 3 million genes. So that's 150 times more bacterial genes than human genes. And then if we take it to a different level, the gut microbiome contains 100 trillion microorganism cells, which is so tough to put into perspective and to wrap our brains around. What does that even mean? 100 trillion microorganism cells. But if you think about it, we are 10 times more bacterial cells than human cells. So it's really important that we understand our gut bacteria and our bacteria. 2/3 of our microbiota is specific to each individual. It's really our own personal gut blueprint. And 99% of the unique genes in our body are bacterial, which really means we are only 1% human. So we can have bacteria in lots of places. We have skin bacteria, vaginal bacteria, but 95% of the bacteria is located in the GI tract. And of that, the vast majority is located in the large intestine. So, one thing that we're going to talk about, and I'm going to try and explain, is that our gut microbiome is really closely linked to our innate immune system and our immunity. And all of those things are impacted by diet. And many people consider the gut microbiome to be the forgotten organ. And that's because those gut microbes that live in us, they're not static. They have a role. We used to think that when we eat, we would just digest our food and then we would poop out the food and that the gut microbiome had no role. And we now know that is the farthest thing from the truth. Our gut microbiome is actively involved. It is changing regularly. It is a living entity, and it really is an organ that we need to think about. When our gut microbiome gets altered, it has been associated with a host of medical issues. Like at this point, it seems that nearly every chronic medical issue that comes up has been linked to the gut microbiome being altered. Rheumatoid arthritis, diabetes, inflammatory bowel disease, fatty liver disease, heart disease like atherosclerosis, obesity, cancers, pulmonary disease, all of these things have been linked to abnormal gut microbiome. So irritable bowel syndrome has there are different types of irritable bowel syndrome. It's not just one. You can get irritable bowel syndrome that's predominantly constipation, where you're predominantly constipated. You can get IBS-D or irritable bowel syndrome, diarrhea predominant, and then irritable bowel syndrome mixed, where you're alternating between diarrhea and constipation. If you have not seen this Bristol stool chart on the right side, I recommend you look at it. We have it in our office space, and I show it to my patients. I think it's really important, and it's a great visual for people because you should take a look at what your poop looks like. Many of my patients don't do that, but it's important to look at the texture, the consistency, look to see the color or if there's blood in it. The Bristol stool chart varies from type 1 to type 7. Type 1, 2, and 3 tends to be in patients who are constipated. And if you see this, are very descriptive, colorful descriptions. So type 1, separate hard lumps like nuts, hard to pass. On the other spectrum, type 7, watery stools, no solid pieces, entirely liquid. The goal is to be close to type 4. But many patients with IBS will either be, like I said, type 1 to 3, constipated, or they'll be 5 through 7, they'll have diarrhea, or they'll alternate. And this was research done, again, at University of North Carolina that showed that depending on the type of irritable bowel syndrome you have, whether it's constipation, diarrhea, mixed, and then they also looked at healthy controls, your gut microbiome will be different. So there tend to be clusters. Patients who are constipated have a similar gut microbiome makeup. Patients who have diarrhea have a similar gut microbiome makeup. There's another subset of patients with IBS. This is called post-infectious irritable bowel syndrome. Now, this occurs when there is a healthy population, a healthy patient, and they get exposure to something. Maybe they had contact with somebody who had a GI illness, they ate something that was abnormal. Anyway, they had some exposure and they developed an acute gastroenteritis or an acute bout of diarrhea and some infection in their GI tract. Now, the vast majority of those patients will recover, but some of those patients will go on to develop post-infectious irritable bowel syndrome. The risk of developing irritable bowel syndrome is 6 times greater after a GI infection. And the incidence of post-infectious irritable bowel syndrome can range between 5 to about 32%. So what is it about those patients that they were healthy before and now they're in that subset that has developed post-infectious IBS? Well, one, they could have some sort of genetic susceptibility. They could have intestinal inflammation, intestinal permeability, meaning that their gut epithelial cell in their GI tract is weakened. They could have some sort of altered sensory motor function. They could have had a more severe case of a GI illness or gastroenteritis. They are more likely to have had some psychiatric or psychologic disturbance. Could be dependent on the bacterial and viral pathogen they had. And it tends to be seen more often in females who are younger. But what it does show you is that some people who have this altered GI tract will go on to develop post-infectious IBS, whereas in general, those people who recover have a healthy gut microbiome to begin with. We know that the gut microbiome is altered in post-infectious IBS. There have been lots of research studies to show this. So let's talk a little bit about, importantly, what impacts our gut microbiome. So as I mentioned, we have trillions of gut microbes, and we have good microbes and bad microbes. And it's important that they are in balance and they live in harmony with each other and with them and with us as the human host. When they become imbalanced and we have an infection or we have inflammation or a weakened immune system, then we tend to see increases and rises in the unhealthy gut microbiome and unhealthy gut microbes, which leads to other diseases down the line. So one of the first ways that we know our gut microbiome is influenced is the mode of our delivery. Whether we had a vaginal delivery or a C-section is one of the first ways that we're introduced to our gut microbes. When patients have vaginal delivery, we are introduced to vaginal microbes. For example, lactobacillus. This is a healthy gut microbiome, a healthy gut microbe. And this allows normal introduction of gut microbes, and it tends to lead to normal development of an immune system. In people who are born via C-section, they're introduced first to skin flora and usually to Staphylococcus, which unfortunately is one of the bad or harmful gut microbes. This can lead to abnormal microbial introduction, and studies and research has shown that this can lead to increased risk for other diseases like asthma, celiac disease. So I'm not saying this to worry or cause concern to anybody. Of course, we can't go back and change the way that we were born, right? So all I am telling you is that there are things that are not in control that are going to influence our gut microbiome. But we have a lot of things that we can do and ways that we can change our gut microbiome to have a really robust, strong microbiome. So that research article, that research that came out suggesting that, potentially it's healthier and there's better gut microbes if you have a vaginal delivery, actually resulted in a lot of public discussion about this. And there was a thought that should C-section babies even get wiped down with vaginal microbes? And at this point, that is not FDA approved. And so it's not evidence-based. But in the future, as we learn more about this and do more research, it's definitely a good theory and a good thought that maybe we might in the future be wiping babies down with vaginal microbes to get that healthy gut, that vaginal flora that they would otherwise have gotten. Okay, so as I mentioned, I am a mom and I have 3 girls. They range in age from 1-year-old to 8-year-old. So this understanding the gut microbiome is not just something that I do as a physician, which it is, but it's also very personal to me because I want my children to be set up as best as possible. The first 2 to 3 years of life, the microbiome increases in diversity to reflect that of an adult microbiome. The microbiome significantly can develop from breast milk. There are over 700 species of bacteria in breast milk. So I encourage those people who have children or grandchildren that if possible, if you can give them breast milk or breastfeed, that's definitely great for their gut microbiome, but also understanding that that might not be possible for everybody. And so really it's most important that the baby is always fed in whatever way possible. We also know that our environment plays a really large role in setting up our microbiome. So children who are in daycare, who have siblings, who have pets, all of those things actually improve and strengthen their gut microbiome. We also know that the microbiome diversity in developed countries like the United States is less than the diversity in underdeveloped countries. So that is very surprising for many people because you would think that we have a really good healthcare system and we would then be setting ourselves up for a healthy gut microbiome. But we think that this might be related to the hygiene hypothesis, which basically says that we are being overly and excessively clean and everything is antimicrobial, hand soap, wash, wipes, and actually that early exposure to dirt and different microbes is really important in our development of gut microbes. Okay, one thing that can also influence our gut microbiome are antibiotics. So let's talk about that. In the United States, over 251 million courses of outpatient antibiotics were prescribed in 2019. At least 28% of antibiotics prescribed in the outpatient setting are unnecessary. So it's really important that you talk with your doctor about the need for an antibiotic. I definitely think there are certain situations where we need to take antibiotics. If you have a bacterial infection, then antibiotics can be life-saving. But what's happening is that we're seeing a lot of patients get antibiotics for viral infections or for other issues that don't necessarily need it. An average American gets about 30 courses of antibiotics before the age of 40. And a lot of it is, okay, one, some patients are getting it because they're overusing it, but also, and really importantly, if we are consuming non-organic meat, fish, milk, eggs, even our tap water, actually, all of these things have antibiotics. 80% of all antibiotics sold or distributed in the United States are used for commercially farmed animals. So if you think about that, if 80% of all antibiotics, that means millions of courses of antibiotics are being used for animals. And if people are eating the milk, eggs, meat, and those animal products, where do you think those antibiotics are going? Those antibiotics are going in our body. They're affecting our gut microbiome. We know that even a short course of antibiotics will change our gut microbiome. One course of antibiotics will produce antibiotic-resistant bacteria in the gut. We know that. We also know that the gut microbiome with time can definitely heal and get better, but it does play a role. It's going to impact our gut microbiome. Okay, so we talked about mode of delivery, we talked about early life exposure, we talked about antibiotics. So a huge thing that impacts our gut microbiome and our mood is food. We have likely all been there, I know I have, where we have overindulged, we have overeaten, we have eaten too many sweets, maybe we've drank too much, and we've all felt that effect and that feeling of being in a food coma, feeling ill, of just not feeling well that can result from that. So that is an example of what we what happens on an extreme way. But just remember, we are eating so much food every single day, and that impacts our gut microbiome and our mood. And we are going to talk a lot about food a little bit later, so we'll come back to that. I just want to go back to our GI tract for a second. One thing that people don't realize about our GI system is that our GI tract is the largest endocrine organ. It secretes more than 24 different hormones. So when I have patients who come in and have hormone imbalance, one of the things that we need to think about is, how's your gut microbiome? Why are you getting all these imbalances? Because the GI tract plays a role in that. We also know that many of these hormones are imbalanced and altered in patients with irritable bowel syndrome. The immune system and the endocrine system impact irritable bowel. The hypothalamic pituitary axis in the brain influences the GI tract through corticotropin releasing factor, CRF. We know that there's elevated CRF during periods of stress. And we also know there's elevated CRF in depression. And what we see during periods of stress and anxiety and depression is that we get increased inflammation. And in turn, that causes increased pain sensation and more pain in patients with IBS. So we know that life stressors, psychiatric illnesses, anxiety, depression impact our immune system. They can create dysmotility, abnormal movement in our GI tract. They can cause increased sensation, different types of secretions. All of this can impact our gut. It can result in low-grade inflammation, immune dysfunction, and then all of this in turn will also impact our gut microbiome. And these kind of all impact each other. They keep cycling back and forth. Don't worry, be happy. So many of you have heard of serotonin. Serotonin is the key hormone for mood and happiness. 95% of serotonin is synthesized and made in the gut. We know that serotonin has a role in the GI tract. It activates nerve fibers and impacts the nervous system. And it also impacts colonic motility and secretion, meaning it has an impact on whether we are going to have diarrhea or constipation and how quickly or slowly things are going to move through our GI tract. The co-occurrence of IBS and an altered GI tract and depression is estimated to be about 30%. In addition to a hyperactive stress axis, endocrine signaling and hormonal regulation are altered in patients with IBS. So this was a study actually looking to see what is going on with the gut bacteria in patients who have depression. This was a large microbiome population study. They looked at over 2,000 people, and gut bacteria were studied as it relates to depression. And really what I'm showing here is that they found different specific strains that were higher in patients who were less likely to have depression. And then they had found more harmful strains of gut bacteria in those patients who were more likely to have depression. So this is really early research, and it's not yet something that we can clinically apply yet, but there's a lot of research coming out showing that different gut microbiome strains are going to be related to anxiety and depression. So this was a really interesting study. It was done several years ago, and it was actually looking to see, can you transfer emotions like anxiety in stool transplants and fecal transplants? So what they did was they took stool from anxious people, and then they took stool from very happy, relaxed people. And they took those stool and they put them in germ-free mice. So these are healthy mice. They don't have their microbiome. They have the exact same environment conditions, same food, and same everything. And then they studied the mice later to see what was happening with the mice. And they found that those mice that got the stool samples from the anxious people, those mice became anxious as well. And conversely, those mice that had stool from really happy, healthy people, they had normal mouse behavior. So this was a really great study that actually shows that you can transfer emotions, anxiety, happiness, depression, all through stool transplants, and just highlights how important our stool is and our gut microbiome is in our mood. We have lots of different treatment options for patients with IBS. We have antispasm medications to help calm down the GI tract, because what often happens is that with the stress and anxiety, the colon starts to spasm and cramp, and that's what causes pain. We often use antidepressants in patients who have IBS. And I do counsel patients, first off, only the most severe cases of IBS need antidepressants. This is not a first-line medication, but in those patients who do need it, the dose we use is much lower dose than the dose we're using on the brain, because we're not really necessarily trying to target the brain. We're trying to target that enteric nervous system, that gut nervous system. And research studies have shown that it is helpful in patients that do have severe IBS. Sometimes we just treat their symptoms. We can use antidiarrheals if they're having a lot of diarrhea, or we can use pro-secretory agents if they are having constipation. There's another medication we can use. This is called rifaximin. Interestingly, this is an antibiotic, but it's a non-absorbed antibiotic. So when you consume it, it is excreted out of you. But it's FDA approved for the treatment of irritable bowel syndrome with diarrhea predominant, based on this theory that patients with IBS have an abnormal gut microbiome. And in a large double-blind study, which is really the kind of the hallmark and the best studies that we can get, they found that 40% of subjects had an improvement in pain and inconsistency. So one thing that's very important is appropriate toileting. This is a picture of my middle daughter when she was younger. And it's, interesting because when you watch babies and children, they instinctively know the right healthy way to poop. The squatting position is actually really healthy for helping to move things through our GI tract and to help get excreted. With our current toilets, we don't use the squatting position, and that actually can cause a lot of constipation in people. One thing that can cause constipation is pelvic floor dysfunction. We all have muscles in our anus and in our bottoms. We actually have kind of two muscles. When we want to poop, those muscles should open up and relax. When we don't want to poop, they should stay closed so that we don't leak all the time. In many patients, those muscles no longer work. For some reason, they have become discoordinated or uncoordinated. And what happens is, instead of opening up to when they want to poop, it closes down when they're trying to poop. And so people might feel like they have a blockage. They feel like they're not emptying all the way. That could be a sign you have a pelvic floor issue. Up to 50% of patients who have a slow colon resulting in constipation will also have a pelvic floor dysfunction. So it's definitely something that needs to be evaluated, because we have different treatment options. All right, let's get back to talking about diet. So we've talked a lot about the symptoms of IBS: anxiety, cramping, bloating, fatigue, abdominal pain, brain fog, vomiting. And we have medications like we talked about to help treat some of those, but those are really treating the symptoms. The main issue with irritable bowel syndrome is that the gut microbiome is altered, and that thin layer of cells that's preventing things from going from the gut to the blood becomes altered. You get gut bacterial dysbiosis, and you get gut permeability, which many people call leaky gut. That is the root of the problem. So one of the best ways to address that issue, to get to the root of the problem, to fix it so you feel better, is diet. So what we eat greatly impacts our gut-brain axis. The foods that we eat can impact that gut barrier function. This is that thin layer of epithelial cells that we talked about. And depending on the foods we eat, we can do things that are going to improve the gut barrier and produce things like short-chain fatty acids and amino acids, or things that we eat can actually harm those get a leaky gut, what that means is these are called tight junctions. It leakens and it worsens this barrier. And you can get, for example, increased bile acid production. So what we eat is going to make a difference. The diet that I recommend for my patients, because I believe that the research supports it, is a whole food plant-based diet. This was a research study done by Rob Knight in 2018 through the American Gut Project. What they did is they looked at stool samples from over 10,000, we call them citizen scientists. So what that means is they took stool samples from people like you or me. They took people in the community and they asked whoever's in the community in your normal environment, we want to collect your stools to see what kind of microbes are in the wild or are in your body normally and naturally. Because many of the research studies that are done are very controlled. We're regulating people, we're watching people, and we just kind of want to know what's going on. And they found that eating a variety of fruits and vegetables is the single best predictor for good gut health. In fact, when they kind of did the research study, they found that any people who ate more than 30 different types of fruits, vegetables, whole grains, they had the healthiest gut microbiome. Now, I don't think there's necessarily anything really special about the number 30. I don't think having 33 versus 27, for example, is going to make much difference. But I think that the point is that we want to eat a variety of fruits and vegetables so that we get a variety of different gut microbes in our GI tract. That's very important. We want a variety of healthy strains. I actually see a lot of patients in my office who come to me and they have a lot of these GI tract symptoms. They have some IBS symptoms and they do eat healthy, but they eat the exact same thing every day. They'll have the same salad, the same vegetables, the same fruit. And while that's good, what you're basically doing is selecting for those gut microbes that like the foods you're eating. So if you eat a lot of broccoli, you're going to get gut microbes that like a lot of broccoli. But what about increasing the gut microbes that like a lot of asparagus? Well, in order to get that, you're going to have to eat asparagus. So variety is very important for your gut microbiome. So this was a study published in Nature. Nature's like one of the top medical research journals. And what they did was they looked at a plant-based versus animal-based diet and how did these diets compare. So they found that there's higher fiber intake in those people who consume a plant-based diet compared to animal-based diet. So importantly, fiber comes from plants. So that's a key point there. And they also found more gut microbiota diversity on a plant-based diet compared to an animal-based diet. So again, that's really an important point if you want to be healthy, and let's all lower our chances of getting chronic medical conditions, chronic inflammatory conditions, is getting gut microbiota diversity. And then interesting, they found that differences between those people who switched to a plant-based diet or an animal-based diet, they found differences in the gut microbiome just within 1 day of the diet reaching the gut. So changes can be made very rapidly. So what are ways that we can improve our gut microbiome? So I get asked a lot about prebiotics and probiotics. So prebiotics are non-digestible substances. They provide a beneficial physiologic effect by promoting the activity of a select number of favorable bacteria. Probiotics are, on the other hand, are the live microorganisms that confer a health benefit on the host. So when we consume prebiotics, which are in lots of the plant-based diet and foods, we are getting fiber. When we consume fiber, that is fermented by bacteria, and that produces short-chain fatty acids. And short-chain fatty acids are the key to a good, healthy gut microbiome. Probiotics bypass the prebiotic step and do help, but not as effectively. So research shows that plant-based diets result in increased short-chain fatty acids compared to animal-based diet. So like I said, short-chain fatty acids are really important. They help to keep that glue between the epithelial cells, to keep that very tight so that we don't get harmful pathogens in our blood. This was an article that looked at a microscopic level. What is happening to our GI tract if we have a fiber-rich diet like a plant-based diet? And let's compare that to what happens to our GI tract if we have a fiber-free diet, predominantly animal-based. So this here is the fiber-rich diet, and this is the epithelial barrier, and this is the mucus layer on top that serves as a protective barrier. And here are the pathogens and our gut microbes. And in a fiber-rich diet, you can see here these epithelial cells are very close. They're tight. We like that. It's not going to let harmful things pass through easily. It also has a thick mucus barrier to prevent, again, harmful things from coming through. That's great. When they looked at the fiber-rich, fiber-free diet, this is what they saw. You can see here these epithelial cells look weakened. They're not as tight here. This is what in many people will refer to as leaky gut, right? They're not as tight. The mucous membrane is very thin, and it's allowing for a lot more of the harmful bacteria to enter our GI tract. So again, this is the difference between a plant-based diet and really the standard American diet, the SAD diet, which is a fiber-free diet. So this is based on the GI guidelines, the American College of Gastroenterology IBS guidelines published last year, and they talk about the role of fiber in IBS. Insoluble dietary fiber, wheat bran, whole grains, vegetables. This increases the fecal mass. It accelerates colonic transit, meaning it helps to move things through. This is very helpful for people who are constipated. Soluble fiber, things like psyllium, oat bran, beans. These are fermented by the large intestine, and these increase stool bulk. So these help for patients who have a lot of diarrhea. They also can help to produce short-chain fatty acids. What happens is that this fermentation process from the fiber decreases the pH, and it allows for the growth of beneficial bacteria. It also stimulates the release of serotonin. We talked about serotonin being that happy hormone. It allows the release of serotonin, and it improves visceral hypersensitivity, lowering pain threshold, lowering pain that people might experience with IBS. In a meta-analysis study, so a large study where they looked at 14 different randomized controlled trials, they looked at almost 1,000 patients. They showed that fiber supplementation helps IBS symptoms. So fiber is a great way to improve our gut microbiome and to improve symptoms in IBS. The best way to have fiber would be a whole food plant-based diet, or at least transitioning toward a diet where you are consuming more fiber. You're consuming more fruits, vegetables, and whole grains. I wanted to talk about probiotics because I get asked this a lot. In 2018, the probiotic market was huge. There was about $40 billion spent on probiotics. The market is expected to be worth nearly $50 billion by 2023. $50 billion. So any aisle you walk down, you just have to walk down an aisle in the supermarket, the grocery store, and you will see so many different types of probiotics. You will see lots of advertising for probiotics. What I want to counsel you on is that there is little information on the probiotic preparation, and they do not require FDA approval for marketing. So there are a few studies where research trials have been done: Visbiome, VSL3, Align, Florastor, Activia. But most of the probiotics on the market, research has not been done. And so we just don't know what exactly is in it. I want to give you the GI guidelines and what they recommend. They analyzed the data on probiotics and IBS, and they said that there was no significant improvement in symptoms in patients with IBS who took a probiotic. They also found that there was a lot of variability. There was a lot of selection bias. The research trials that were done were not as thorough as we like them to be. And based on this, the American Gastroenterology Association does not recommend the use of probiotics for most GI and digestive conditions. In symptomatic children and adults with irritable bowel syndrome, we recommend the use of probiotics only in the context of a clinical trial. No recommendations. There's a knowledge gap here. And we are definitely learning a lot about probiotics. And we are trying to understand which strains would be helpful, how much of each strain is helpful. As of now, we just don't have enough information. So I don't routinely recommend it for all patients. So again, what I do recommend is dietary changes. This was a Harvard study that looked at dietary intervention in the gut microbiome. They took patients and they had them either be on a really strict plant-based diet or on an omnivore diet where they predominantly ate animal-based products. They collected stool samples and they did gene sequencing. And again, what they found was that changes in the gut microbiome can be seen within 1 day of starting a diet. They also saw that when the study was finished and people went back to their normal habits and their normal eating pattern, that within just 2 days of going back to their normal diet, the bacterial composition changed again. So what this tells us is that if we want to make a change to our gut microbiome, we can. If we want to improve our gut microbiome by eating a variety of fruits, vegetables, whole grains, we can improve our gut microbiome. But this is a long-term plan. This is not a short-term plan. It's not something that we can do for 2 to 3 weeks and then go back to our old habits. It needs to be a constant, consistent change that we make in our lives because our gut microbiome can change and be influenced drastically either way. So I want to also talk about fermentation. This is the process of converting carbohydrates to alcohol or organic acids. This is a process that uses microorganisms, yeast or bacteria, usually through the production of lactic acid bacteria. Fermentation has been used for thousands of years as a method to preserve food, dating back to 6000 BC. In fact, in 1908, the Nobel Prize in Medicine was won based on fermentation. They found that aging is caused by toxic gut bacteria and that the lactic acid bacteria could prolong longevity. Different examples of fermented food include sauerkraut, yogurt, kimchi, and kombucha. And so I do recommend increasing or incorporating fermented food into your diet. It is important that when you're doing this, that you don't take an excessive amount at once. Fermented food should be a small quantity. And if you're not used to taking fermented food, please start small and slow and then increase, because otherwise you can get gas and bloating. But I do recommend incorporating fermented foods. This was a study that was published in Cell last year, and they showed that the gut microbiome improved with high fiber diet and with a diet high in fermented foods. They found that high fiber diet changes the microbiome function and influences the immune response. They also found that fermented food diets increase microbiome diversity and it decreases inflammatory markers. So consuming both a diet high in fiber and fermented foods might be beneficial and potentially the best way to improve our gut microbiome. So this is just a cartoon. He says, I think we're at a crossroads, everyone. Do I start exercising and eating well, or do I just let myself go and embrace it while living blissfully meal to meal? The brain says, a long-term investment in your body will have a much greater payoff. be smart about this. The heart says, love who you are, no matter what, and the rest will work itself out. This, I think, is the gut microbiome, the bacteria. Replenish the kookiness, or I will usher in a new era of darkness upon you all. That junk the heart said about loving your body or whatever. So really, this is a long-term solution. This is a lifestyle. Be kind to your body. This is not a diet or a short-term fad. Perfection is not necessary. It is more important to be consistent. If you're consistent and you fall off for a while, that's okay. Don't be so harsh on yourself. What about the low Fodmap diet? So Fodmaps are fermentable oligodimonosaccharides and polyols. They are poorly absorbed in the small intestine. They're osmotically active, and they increase water delivery to the colon. They are rapidly fermented by colonic microbiota, resulting in gas production and colonic distension. So the low Fodmap diet is a potential short-term solution for patients with IBS. Now, you're not going to be able to read the charts that I have put on the right side here, but it's just to show you that there is information available that would show you what foods are allowed on a low Fodmap diet and what foods you should really try to eliminate on a low Fodmap diet. For people who are familiar with this, or if you look this up later, it can be a very restrictive and challenging diet. There are lots of things on the elimination aspect. There's lots of fruits, there's lots of vegetables, legumes that you need to eliminate. So it can be very restrictive. Please always talk to a dietitian and your doctor when you're thinking about the low Fodmap diet. Now, this was a research study published in Gastroenterology, the top GI journal, and they looked at prebiotics compared to a low Fodmap diet and what that does to the gut microbiome and what it does to patients who have IBS symptoms. What they found were patients who were eating a high fiber diet or prebiotics had beneficial microbiome changes, and they had improvement in their GI symptoms. Now, patients who are on the low Fodmap diet, unfortunately, they had also had microbiome changes, but the microbiome changes that they had were harmful changes. They actually had increases in some of the harmful gut bacteria. However, they did have improvement in their GI symptoms. So the way I think about a low Fodmap diet is you might have short-term gain. You might feel better in the short term, but in the long term, you're going to have long-term pain because you are negatively impacting your gut microbiome. So it's short-term gain, but long-term pain. And so if we can avoid doing a low Fodmap diet, I do recommend avoiding it. This was a research study looking at the gut microbiome, looking at symptoms in patients with IBS who did a low Fodmap diet compared to the traditional IBS diet. So the traditional IBS diet is where you essentially try to keep a log and a food diary and figure out yourself which foods are triggers for you. And what they found was there was really no difference. So when patients tried to do it on their own and figure out what were their own food triggers, that was resulting in the same end result in terms of symptoms as patients who followed a really strict low Fodmap diet. Okay, this was a research study looking at a low Fodmap diet compared to yoga. It was a randomized controlled study. So people were either put into a yoga group or the low Fodmap group. And they found that at both 3 months and 6 months, there was no statistically significant difference between the yoga group or the low Fodmap group. So like I said, I think that the low Fodmap diet can be very challenging and restrictive. So instead of doing that, I would suggest to many of my patients incorporating yoga into their lifestyle, which can help to reduce the stress and the anxiety, which can help to improve their gut microbes. And they will have the same result in their IBS symptoms as those who followed a strict low Fodmap diet. One of the key things that impacts our gut microbiome is stress. We've talked a lot about some of the others, the diet, the antibiotics, but stress plays a huge impact. With COVID, we have seen such a significant rise in patients experiencing IBS symptoms because COVID has caused such severe stress on all of us. And what we have seen with that is that there is decreased diversity and richness of the gut microbiome. There are more pathogens, and there's more gut bacterial dysbiosis, resulting in an abnormal immune response, lowered epithelial integrity, lowered mucosal immunity, and we are seeing more GI diseases and more of other diseases as well. Our GI guidelines suggest that psychological therapies like cognitive behavioral therapy, relaxation therapy, hypnotherapy, all of those have been shown to improve IBS symptoms. Is all stress bad? Well, no, all stress is not bad. I studied biological anthropology when I was a college student at Harvard, and we know that stress came around for specific reasons. Stress is really important in stimulating our immune system, in helping us with that flight or fight response. The problem is that many and most of us are now living in a time where we are under chronic, severe, daily, debilitating stress. We are not just experiencing short terms of bouts of stress that are helpful. We are experiencing the burden of stress. We are experiencing high levels of stress daily, and it is impacting and destroying our gut microbiome and impacting our quality of life. The one thing I'll say about stress is I'll have patients who have IBS, and they try to figure out what foods are triggering their symptoms. And they'll tell me, I went out and I'm keeping a food log, and I went to this restaurant and I had spinach with cucumbers and tomatoes. And that day I noticed a flare in my symptoms. And so I think it's the tomatoes that are just causing the issue. I'm going to eliminate tomatoes. Okay, I'm not sure that's the right way to go about it, because if you have tried this before, those same patients have eaten tomatoes on a different day and not had any issue. It's not always the food that is causing the symptoms and triggering the symptoms. It's also the stress, the environment, what's going on around you. If you are eating on the go, if you are eating quickly because you have a stressful meeting, if there are other things in your life that are happening around you, your gut will pick that up, and it doesn't really matter what you're eating, your GI system will react. So I want you to be cautious and careful when you think about that, because it's not always the food. The stress and your environment also will play a role. And so in those situations, it's definitely worth trying that food item again, because otherwise you'll end up on a very restrictive diet, which is not going to be healthy. Cognitive behavioral therapy has been shown to be really helpful for patients with IBS. This is a form of psychological treatment that is effective for depression and anxiety. It usually involves changing thinking and behavioral patterns. It uses problem-solving skills to cope with difficult situations. It helps people to face any fears they have instead of avoiding them. And it helps patients to learn calm, relaxed, and gives them breathing techniques. There have been 9 peer-reviewed trials comparing cognitive behavioral therapy to control patients, and they found a 64% improvement in patients with cognitive behavioral therapy. So I do recommend cognitive behavioral therapy for many patients, and I usually refer to a therapist for their assistance and guidance. This was a research study looking at CBT. And actually, I think this is very pertinent when we had COVID and a lot of things went virtual, because what they did was they did a 3-arm randomized control trial, meaning they took patients and they put them in 3 categories. 1, telephone delivered cognitive behavioral therapy. 1, web-based cognitive behavioral therapy. And lastly, treatment as usual. And they found that patients and participants were adults with refractory IBS, meaning they had symptoms for over 12 months despite all the treatments. And they had a telephone and web delivered cognitive behavioral therapy. And those patients had statistically significant improvement in their IBS symptoms. Those symptoms and relief in their symptoms lasted for over a year. So when patients have cognitive behavioral therapy, they get really long-lasting improvement. What about yoga and IBS? This was a 12-week randomized controlled trial comparing yoga and conventional therapy to a control group. And they found significant improvement in abdominal pain and quality of life in the yoga group. And based on this, yoga can be used as a standalone treatment or in combination with conventional IBS treatment. What about exercise? Well, this was a study done. It was a prospective randomized controlled trial. Again, I mentioned these, the study trials, because these trials are both the yoga, cognitive behavioral therapy, and exercise. These are some of the best trials we have to look at these things. So this was a study where they looked at control group, meaning they did their routine IBS care versus patients who exercise. And they found increased physical activity, improved GI symptoms in patients with IBS. Based on this, exercise should be used as a primary treatment modality in IBS. Now, why does this work? There are some suggested mechanisms. We're still learning and understanding more, but we think that exercise counters the effects of stress by reducing neuroendocrine response and visceral perception. Physical activity improves brain plasticity, neurogenerative, and neuroprotective process. It improves intestinal gut clearance and transit time. So this is really helpful for my patients with constipation or bloating. Exercise is very helpful for that. And also, we talked about short chain fatty acids before when we talked about a whole food plant-based diet and how important short chain fatty acids are for keeping our mucosal lining and our gut barrier. And exercise increases short chain fatty acids. This was another study looking very specifically at exercise and the gut microbiome, and they showed that exercise increases short-chain fatty acids, which have been proven to reduce inflammation and improve the gut microbiome. They found clear clustering of the gut microbial populations in athletes compared to controls. So what they did actually is they took, this is the controls in the red and the green. They stratified it based on their BMI, their body mass index. And then they looked at these elite athletes. And the bottom line is that those patients and those people who exercise more, those athletes, they clearly have a different gut microbiome makeup, and you can see that. Depression and stress impact the immune, endocrine, and autoimmune nervous system. This can lead to gut dysbiosis. This can cause low diversity in our gut microbiome, which can lead to leaky gut. And behavioral changes, diet, sedentary lifestyle, lack of sleep, and alcohol use, smoking, all of these things can affect both our mind, our mood, and our GI tract. So 6 practical tips to help with IBS. 1, mindful plant-based eating. As much as you can, try to eat a diverse amount of fruits, vegetables, whole grains. You know, one thing that me and my family do is we like to make a game out of it, especially if you have kids or grandkids. We like to try and keep a list of all the different foods that we eat in the day and see who eats the most in a day or a week, and just make a fun game out of it. Or if you're going to the grocery store, don't be hesitant to try something new. Try something new, get some diversity, be adventurous with your food choices. 2, minimize processed foods, dairy, and meat. Processed foods, especially processed meats, red meat, deli meats, they're actually considered carcinogens, cancer causing. So as much as you can, minimize, eliminate those things. Dairy really flares IBS symptoms for a few reasons, but a lot of patients will develop lactose intolerance, and that dairy just triggers these symptoms, especially patients of mine who have bloating. They will notice a significant improvement if they cut out dairy. So if you can't do anything or you feel like this is just too overwhelming, the first thing I usually recommend is to eliminate dairy and see how you feel. And I can't tell you the number of patients I've had who have made that change. And once you make that change and you feel better, your GI tract feels better, your mood feels better, you're able to go on with your daily activities of life, and you just have more energy, like that's enough of a change for you to then go forward with other changes. 3, it's important to remember that this is about maintenance. This is not a quick fix. There is no quick fix for irritable bowel syndrome. There's no quick fix for your gut microbiome. These are all long-term lifestyle changes. So don't get frustrated, and just do the best that you can. Be kind and gentle to yourself during this process. 4, meditation and yoga. I've shown you the research today that shows that cognitive behavioral therapy, meditation, yoga, all of these things that calm our mind and our body also influence our GI tract, and they can calm our GI tract down and help with IBS. 5, moderate regular exercise. We know that exercise increases short-chain fatty acids like butyrate and acetate. And by improving those short-chain fatty acids, we are setting ourselves up to get a healthy GI tract and gut microbiome, which again will improve our IBS symptoms. Lastly, number 6, move more. Dance, party, have fun. It is so important that we remember that what we are thinking, our mood will impact our GI tract. So have fun, laugh, spend time with friends. For example, when in my house, when we have dinner, we really make sure that dinner is a family affair and everybody is there and talking and hanging out, because that social interaction is really important in helping boost our own mood and then boost our GI tract. So you might have heard the expression, you are what you eat. And while that is true, I also want to remind you that you are not just what you eat, but you are what your gut microbiome eats. So it's important to feed your gut microbiome, and also you are who you eat with. Research has shown, and we didn't have a time to go into it, but research has shown that your friends and your friends' friends, you all have similar gut microbiome makeups. Our gut microbiome changes and alters to be like our family and friends. So the people you surround yourself with have a huge impact in how you feel and how your gut microbes feel. Gut instinct or gut bacterial instinct. So the GI tract says to the brain, I don't like it, brain. I just don't like it one bit. The brain says, I trust you, gut. Just tell me why so I can try to fix it. The gut thinks and then can't figure anything out. So it just says, not one bit. The brain walks away. Okay, then. And I bring this up because we are learning so much about the gut microbiome at such a rapid rate. We don't have all the answers yet. We might not know why things are happening the way they are. We don't know for sure which gut microbes are involved in GI illnesses and mood, but we are learning about it. So at this time, sometimes you do just have to trust your gut. So I hope you remember that. And that's it. Thank you. I hope this was helpful. You can reach me on my website, sign up, and I will be getting a newsletter out soon. I'll be giving tips to help with bloating and gas. So lots of things coming up in the future. So go to the website, sign up for the newsletter, and definitely follow me on Instagram and Facebook at Doc Sarina. Thank you.
Thank you so much, Dr. Sarina. Really, really thorough, and I know we really all appreciate this. You're ready for some live Q&A, I assume?
Yes, definitely.
Excellent. Thank you so much. And before we jump into that, just to make sure, and thanks for sharing your website, is that the best place for people to get your book, or is there another place, or what do you
So I
recommend?
don't have a book yet, hopefully
Okay.
in the future. If you guys find this helpful, then that'll just be more motivation to get one. But that's where people can find me, and I'll be getting a newsletter soon and definitely giving tips, and hopefully get an ebook out soon.
Perfect. Thank you so much for that. And so I see some hands raised already. And that's how we do it. I want to make sure everybody knows that's how we do it here at The Real Truth About Health. We normally do not take questions directly from the chat box. We do ask everybody to go ahead and raise their hand. And so in case you don't know how to do that, everyone, down at the bottom of your Zoom screen, you'll see different tabs. One of those tabs says reactions. You click on your reactions tab. And once you do that, you'll see different emojis, and one of them says raise hand. You click on that function. We'll see your hands coming in, and we go ahead and select questions or hands raised in the order in which we receive them. I'll go ahead and unmute you, and I'll call you by your first name, and you can go ahead and ask your question of Dr. Sarina. And so with that, I think we're ready to go. So I'll bring in our first question, and this is going to be Michelle. Michelle, welcome.
Hi, thank you. It's your presentation was amazing. I love your visual, that you're very, very visual when you present. So thank you so much. I'm a registered holistic nutritionist, and I help a lot of people. Like almost every single person I help, even if it's not the reason they came in, has some sort of a gut problem, because as you know, all disease starts in the gut. You touched on the importance of or the impacts of birth, vaginal birth versus cesarean section. And I've certainly studied that before and seen lectures on it before. I'm curious what your opinion is on the impact of if mom had a Western diet and high anxiety and, poor environment, and grandma had a highly processed, poor diet, high anxiety. What are the impacts generationally on that baby? Is the vaginal birth, I know it's still going to be better, but is it disadvantaged by inheriting those traits from mom and grandma?
Okay, so you bring up some very good points and very good questions. So thank you for that. So this is actually very interesting, because one of the reasons that I got started in trying to understand and learn more about the gut microbiome is because it happened when I was pregnant. So when I was pregnant, I was in my GI fellowship training, and I was trying to do whatever I could to help with my my daughter. Now, what I didn't realize is actually the foods that we eat when we are pregnant do impact the gut microbiome of our children. I didn't know that. I actually thought that it all definitely started after birth, and I got to make sure that she's eating the right stuff later. But we are now learning that, yes, what mother eats, anxiety, depression in the mother, all of those things will influence the gut microbiome and the taste buds of the baby. So it is important that those people who are pregnant or thinking about pregnant do eat healthy variety of fruits and vegetables. Now, your question is asking, can the harmful things, the processed foods and anxiety and depression, be passed on through the vaginal delivery? And I don't think we really have a clear answer for that. I think that at this point, it still is, if possible, it is better to have a vaginal delivery. And because what's happening is, if mom has an unhealthy diet of high processed foods and high refined sugars and has a lot of anxiety and depression, those things are already setting up that person for a slightly unhealthy gut microbiome. So I wouldn't want to make that worse by actively seeking out a C-section. I would try to do everything that I could to improve it by at least having the vaginal delivery and getting exposure to lactobacillus first. So, we're learning a lot about this, but we do know that what mom eats does influence the babies now as well.
Thank you so much for that, doctor. And with that, I'm going to go ahead and now bring in Janet. Janet, you are unmuted. Welcome.
Hi, thank you very much. Thank you for your presentation. Sometimes when you're eating a whole food plant-based diet, because you're eating so many vegetables, beans, it can cause a lot of gas and bloating. What are your suggestions for that? And what do you think of digestive enzymes? And also wanted to know what your thoughts were on the treatment of SIBO, small intestinal, bacterial overgrowth. Yes.
Okay. All right.
Thanks.
So bloating. Okay. Bloating is so common. It's commonly seen in patients with IBS, but it can be seen in anybody. And the hardest thing when my patients are transitioning to a whole food plant-based diet is they complain of bloating. So there are a few things to think about. One, bloating in and of itself is not necessarily harmful. We know that when we eat a predominantly plant-based diet and there is fermentation in the GI tract, we are going to get bloating. So it's only an issue if it is causing you physical discomfort or it's impacting your daily activities. The other thing is there are ways to decrease the bloating. So the first thing is, if you are not used to a plant-based diet, it's not always recommended to go from 0 to 100. So you don't need to go from eating minimal fruits, vegetables to all of a sudden having 100 grams of fiber in a day. I recommend kind of going more slowly. You have to rehab your body and you have to rehab your GI tract. You have to train your GI tract to get used to eating fiber and high amounts of fiber. So just because you experience some bloating when you start a high fiber diet does not mean you should stop or reverse. It does not mean that it is always harmful. It is part of the process. Fruits and vegetables can cause bloating. And then there are other things you can do to help. So for example, ginger. I use a lot of ginger in my cooking, and ginger can help to reduce the bloating. So there are different techniques you can do to help, but the first thing is don't go from minimal fiber to high amounts of fiber at once. Go slowly and take your time incorporating those things. And if you find there are certain foods that are always a trigger, just scale back on that. But ginger is a great way to start with some of that.
Thanks very much for that, doctor. And
sorry, and there were a few other questions. I didn't remember those. So sorry, I am happy to address those if you want.
You know what? And I'm so sorry we lost her, but if you would raise your hand again, we'll try to get right back to those questions as soon as we can. Sorry about that.
Do you want me to address those?
Oh yeah, if you have those, yeah.
Yeah, I do. Sorry. So one of the other questions was kind of what's my thought on small intestinal bacterial overgrowth? So that's SIBO, small intestinal bacterial overgrowth. So like I said, 95% of the bacteria in our body is in our GI tract. The majority of that is going to be in the large intestine, but we also have bacteria in our small intestine and even in our stomach, for example. SIBO is when you get abnormal growth of bacteria in your small intestine. And we are still learning a lot about this. Is this because we have abnormal gut bacteria in our large colon that is moving retroactively kind of like upwards into our small intestine? Why do we have small intestinal bacterial overgrowth? Why do we have abnormal bacteria in our small intestine? We don't know, but we do have treatment options. We sometimes will give an antibiotic for this. I do recommend a whole food plant-based diet because if all of this is related to an altered gut microbiome. And the symptoms of SIBO can be very similar to IBS, bloating, gas, diarrhea. So SIBO, definitely we have tests to check for that. We have breath tests. So if there is concern that you might have it, get tested, get checked. And there are other things too, motility issues. If anybody has a motility issue like scleroderma, other autoimmune conditions, it puts you at a higher risk for developing SIBO. So that was one question. And then there was another question on what are my thoughts on digestive enzymes? So we do not have great clear-cut GI evidence to recommend pancreatic enzymes in most patients. If you have an enzyme deficiency, which we can check for a lot of times, then we will give you digestive enzymes. It's usually in patients who have chronic pancreatitis or a pancreatic issue. Like I said, we can check for those, but I try to do everything as evidence-based as I can. And at this time, there are no guidelines to recommend giving digestive enzymes routinely. So I do not recommend it.
Again, thank you very, very much, Doctor. And so now we'll move on to our next question. And I hope I'm pronouncing your name correctly. Is it Soman? Welcome.
Yes, thank you. Thank you for that presentation. It was amazing. So I have been whole food plant-based for around 5 years, mostly SOS free, but I've been having trouble with both type of incontinence since around like 9 months. Before that, I did transition to a raw diet, so I was eating over 100 grams of fiber. I started pelvic floor therapy since around 6 months, and I had a colonoscopy and everything was normal. And they also did a perianal exam and everything was fine. I went to a urogyna and she did some ultrasounds and everything was also fine. So I was finally diagnosed with IBS. So they gave me like a low dose antidepressant. And since then it's been getting better, but now it's like more constipation too. So, and yeah, I've been using like the squatty potty and doing yoga and walking. I have now transitioned to a more cooked diet, and I started working with a plant-based dietitian to help me with the diet. And like, I don't know what is going on. Nobody know what is going on, but I suspect it might be like slow motility. But I tried like the beat test, but I don't really see anything. Like, yeah, I don't know. Do you have any recommendations to work with my team, or? Yeah, I'm kind of lost. I don't know what else to do.
Yeah, I think you definitely sounds like you have a team that's working really well with you, and you've had a really good workup. I see a lot of patients with pelvic floor issues, and they present as really one of two ways. One is you can get constipated because that pelvic floor is very tight and it's not relaxing, and then you get constipation. On the other hand, there are patients who have a very weak pelvic floor. We tend to see this a lot in women as they get older, and women who've had childbirth and experienced childbirth, because the pelvic floor gets really weak, and then people have leakage and incontinence. The best workup when we're thinking about a pelvic floor issue is to see somebody who specializes in this. We can do something called an anorectal manometry test. This is a test specifically looking at your muscles in your bottom to see if they are working. Now, you've had that done, but just to kind of explain it for other people, this is a great option for people who have diarrhea or constipation, because sometimes you're already doing what you can with your diet, and you might still be constipated, or you might still be having like leakage or accidents. And sometimes we need to work together with a physical therapist. And actually, I have a lot of patients who have been on long-term stimulants to get them to move. And we're able to wean off of those stimulants and laxatives because it's really a pelvic floor issue. So, I mean, it definitely sounds like you have a really good team. I think they're doing a lot of the appropriate workup. You mentioned something called the BEAT, like a BEAT study. So that is kind of like a layperson way for us to assess motility. See, when we eat, things should pass through us. And so many people eat beets because they're red. And when you poop them out, you'll start to see red in your poop. And it's like a lay way of getting a sense of if your motility is working very fast or slow. If that's all you've done, then we actually have other tests to look at motility, something called a SITS mark study. And this is helpful for either constipation or diarrhea. You swallow these capsules. They have little tiny rubber bands that are radio opaque. We take an x-ray a few days later and we count up and see how many are there. And it gives us a sense of, is your GI tract moving too fast, too slow, or is it moving on target? So that might be a way to kind of get a little bit more of a formal way to look at how quickly or slowly things are moving. And I think one other important thing that you mentioned is that you had diarrhea and now constipation. And that is something that we do see in a lot of patients. And I mentioned this before, but to emphasize, our diet makes a difference, but also like everything else that's going on around us can have an impact. You know, there are periods, for example, many people, when they travel, they will notice that they get constipated. And it's not like they're thinking in their head, I don't want to have a bowel movement. No, it's they go regularly at home, but when they are traveling, their gut picks up on that environmental change and it slows down. And so whenever you have those swings, there might be other things too going on in the environment. But without looking more into it, I think you have a really good team and they definitely seem to be doing a lot of the workup.
Thank you so much, Dr. Sarina. And we'll move on now to Ed. Ed, I'm unmuting you and welcome.
Hello, thank you. I enjoyed your talk. I've been doing a lot of the things that you have been suggested, and now I'm kind of asked, I have IBD that I developed in the military, and they told me most people have it when I went to go see my primary care physician there. And so anyway, what I do is I eat a combination of wheat bran, raw oat grouts, sugarcane fiber, because I grow my own sugarcane, and then maybe inulin, in the afternoon. And then I try to eat fermented food. So I make my own milk kefir, water kefir, and kombucha. And then, I've been getting into fermented salted foods like sauerkraut and kimchi. My question is, and like the other person, I go wax and wane. Sometimes it's fine. Sometimes I'm more on the constipated side. Sometimes I'm under stress, then it'll be more loose stools. I do find if I try to push the fiber too much, then I'm going to the bathroom like 5-6 times a day. It's easy, but then you feel like you're living on the toilet. So in terms of, I've kind of front load, I guess, my fiber because I had it to my breakfast cereal, and then maybe inulin in the afternoon. Should I spread this thing out? And then, if you take things like kombucha, do the short-chain fatty acids, the acetic acid stuff, does it actually reach the colon, or do you absorb it like in the duodenum?
So thank you for your time in the service. We see a lot of patients from with a military background who do develop IBS, and because that you've been in a very stressful environment at times. And so it's really important that we all remember that early childhood and even adult stressors impact our GI tract. So we do see that very commonly. So one thing that I will also mention is that, sometimes you have constipation, sometimes you have diarrhea. And this is why it's so frustrating. Like you said, that people are spending their day living in the bathroom, and that's not a great way for quality of life. Now, many of you guys who are listening and watching, you guys are doing everything you can. I mean, you guys are here, so you're learning about whole food, plant-based diet. You're trying to eat healthy and trying to do the right things. But sometimes we can still have those fluctuations and changes and sometimes still have the symptoms. So one thing that is okay is it is also okay to take additional medications as needed. For example, I let my patients know that it is safe to take Imodium, for example, an anti-diarrheal. If you're doing everything you can with diet and lifestyle, there are going to be triggers or days where you're still going to go frequently. And it is safe to take something like Imodium. We used to think that if we took long-term Imodium or long-term stimulants, if you're constipated, that you would get dependent on it and your GI tract would stop working. But that's not the case. We know that's not true. So it is okay to take an Imodium so that you can get out and go do your activities and not be in the toilet. And conversely, it's okay that if you're still constipated, despite some of these things, to take a stool softener or a stimulant to help you go. Sometimes, like in addition to diet and lifestyle, we need to also use some of the medications and the things that we know that can be helpful. So, that's kind of what I would recommend for that. And I think the only other thing with the kombucha is just be really careful because there can be a lot of sugar in that. So just be mindful how much sugar, and it can be acidic. So I do like kombucha, but I will usually water it down, and add a lot of water. So I get some of the health benefits, some of the flavoring, but I'm not overindulging on that too, because too much sugar, of course, will throw off our GI tract. And then I think a theme that I see in my office, and I'm clearly seeing here too, is that it can be very frustrating because the symptoms change. And so to remind yourself that if you've been diagnosed with IBS and everything else has been checked, it's not anything worrisome. IBS in and of itself, although it is uncomfortable and it impacts quality of life, it is not putting you at any increased risk for like a cancer necessarily. It's not, unlike inflammatory bowel disease, where if it's uncontrolled, you can get an increased risk for colon cancer. Irritable bowel syndrome does not do that. So sometimes I think that helps because, even if you don't have IBS, people have fluctuations in diarrhea and constipation. So if you have it, you're just much more likely to get it. And it's not always something that it's always under control. It can flare here and there too. And also many of my patients who've had this have been having symptoms for like 10, 20 years. So just remember that it can also take years to heal. This is not a quick heal.
Excellent, doctor. Thank you very, very much for that. And now we'll go ahead and move on to Tina. Hi, Tina. Welcome.
Hi. I have a different type of question. I had a IBS for years and years, probably about 20 years, and I had my gallbladder removed and had some procedure they did, and it pretty much resolved. But I still have constipation and diarrhea. I still fluctuate between those two, but I don't have the cramping and bloating and the other uncomfortable syndromes that were associated, and I didn't have to take belladonna anymore. And I was just wondering, is there anything I can do about the constipation and diarrhea? I've been doing the whole food plant-based diet. I haven't had meat in like probably about 6 years now, but I still have my days. I guess I have trouble. Do you have any suggestions?
So it sounds like if you're having the alternating constipation and diarrhea, we would consider that irritable bowel syndrome mixed. And the other thing too is that many times gallbladder symptoms can mask as IBS. So I think it was good that you had that evaluation done, because sometimes if people are having abdominal pain and symptoms, it is a gallbladder issue. That's why it's always important to make sure there's nothing else going on when you're being diagnosed with IBS. So it sounds like you're doing a lot of the right things to help with the irritable bowel, with the plant-based. Sometimes a little bit of additional fiber supplement can be helpful, something like Benefiber, but also that's not very helpful always. Honestly, it sounds like you're doing the right thing with the plant-based diet. It just can take time, and then you would be the right person to take an Imodium as needed, and just pay attention to what other things are going on. Because usually when people switch to the diarrhea side, it's because they're having increased stress and something going on in their lives that are causing the colon to increase the transit time. And then lastly, anybody who's had their gallbladder removed who is having diarrhea should also be checked for something called bile acid diarrhea, because the gallbladder, the function is to store bile. When you do not have your gallbladder, you're no longer storing bile, and the bile is being secreted and excreted into your colon. And that in and of itself can cause diarrhea. So if you haven't been checked for that, you might want to look into that.
Thank you so much for that, Doctor. And now we're going to go and head over to Norman. Welcome.
Hi. Thank you for this useful presentation. My question relates to the variation of plants for more diversity of bacteria. I'm healthy, eat only raw whole plants and like mono meals. Is it enough to eat something different each week, or should I try to eat 30 different plants with each meal?
I missed the beginning of your question a little bit. Is your question, is it okay to eat the same fruits and vegetables in a week, or do I recommend you get more diversity? Is that the question?
Yes.
Okay. Yeah. I do recommend a diversity. As if you can get a variety, you are feeding a variety of your bacteria so that you're getting the bacteria loving bacteria that's going to love different foods. And we know that variety and diversity in the bacterial strains is important. And the best way to do that is the variety in the foods. It also depends on where people are in their journey. It sounds like you are already eating a predominantly plant-based or a plant-based diet. So then the next step would definitely be to increase variety of grains and vegetables and fruits. If there are people who are on a regular standard Americanized diet who have very little fruits and vegetables, then I would say instead of focusing on variety, just focus on getting in fruits, vegetables, whole grains that you like. Start basic, start with things that you know you will eat. Because if you eat too much variety and you get turned off by it and you want to go back to your processed foods or dairy and meat, then we've not set ourselves up for success. And we really want to do that. So it really depends where you are in the journey. First step is to incorporate more fruits and vegetables. Next step is to minimize and decrease processed foods, meat, dairy. Then I feel like the last step is really to try to diversify.
Again, thank you so much for all of that. And we've got a few minutes left. And so I've got somebody with the first initial G, and welcome.
Yes, I have two questions. One is, are things like shiatsu and qigong and douyin as effective as yoga in your recommendations? They're all calming.
Yeah, sorry, continue.
They're all calming forms. And I do have another question once you've answered that.
So I do think that they are helpful. I think that anything that calms down our brain and our body and our mind and can still that, anything like that is going to be helpful and beneficial. So I would say definitely incorporate that into your lifestyle. That's only going to be helpful. I don't know if there are any specific studies or research trials looking at that. But just because we don't have research trials on those things yet does not mean that they're not helpful. So I would say if it's helping you, definitely I would do those things, because anything that is going to impact the mind, the brain is going to impact the GI tract and will be helpful.
Okay. And my other question was, I've understood from past studying with people, they sometimes recommend chewing foods separately by themselves. And in fact, some people are funny about having foods on the plate next to each other food, but because different enzymes or different something or other like to work on one food, mix them, it's not as effective. I'm not sure even what my question is, but it's basically about mixing foods, eating them separately.
I can't comment too much on that. I mean, I've heard some similar theories, and I think that there are some practices that do say that you shouldn't mix certain things. In my, gastroenterology training, we did not learn much about that, and we don't have much advice on that in the medical research in the GI field. So I feel like it's a little bit outside of my area. I wouldn't be able to comment on it. There's nothing in the GI literature that I have studied that specifically says you should not combine certain things, but that does not mean that you shouldn't. There's a lot of other research out there. So I would definitely have to look more into that right now.
Thanks very much, Doctor. We are right up against the clock, but we do have one last question. If we can squeeze it in real quick, I'm going to call Janet, if you can go right ahead.
Hi there. You were talking about the gallbladder, and I'm on a whole food plant-based diet. I am eating like nuts and seeds, flax, chia, and avocado, but finding I can't digest fats anymore. Was just wondering, feeling a bit nauseous, what kind of tests could you get done for your gallbladder? And if you feel it is a gallbladder issue, should you just eliminate all your fats, or are there foods that can help? Thank you.
Yeah, if you think that there's a gallbladder issue, then I would definitely talk, even a primary care doctor could start by working it up. We usually check liver labs. They might get a right upper quadrant ultrasound, looking just to see, could you have stones? What else is going on in your gallbladder? And then there's a study called a HIDA scan, which very specifically looks to see if the gallbladder is squeezing properly. Because if it's not squeezing symptoms. So we definitely do not want to do any surgery of any sort without, or that we have an issue with the gallbladder. So you can definitely get worked up. And I wouldn't start by eliminating or changing your diet yet until you get it evaluated, because it might not be an issue, and then you've altered your diet and potentially made it more restrictive.
Well, thank you for that. And thank you for this very thorough presentation, and really for being so gracious with all of our Q&A here today. And you shared so much. It's so important to so many people. And we really, really, really appreciate it, Dr. Sarina. And actually, I want to thank you, but I know I'm not the only one. So I'm going to ask our tech team to unmute our entire audience. Everyone, what do you want to say to Dr. Sarina?
Thank you very much.